Tell me if...
Action.
Action?
Yeah.
It's on video, right?
Mm-hmm.
Cool. Oh, yeah. So, neck. Neck. The simpler neck stretch is actually traction, in which you don't move the neck, but you actually elongate the head away from the thoracic spine. Yeah? And how do you do that? You need to kind of create, it's hard because you can't clamp the head and move it. So you need to either do one of these, yeah? You take one hand underneath, one hand on the forehead, and then you kind of reduce the space between, adjust them, and then push it together. Or something similar to. So, one hand underneath it, one hand on the head, and then it's actually my body move. Okay? This way, yeah. Because I want to have a traction, yeah? And I need to feel whether it works. You can do it on, actually on the other way. Maybe the camera can come here. So what I'm doing, I put the contact of my base of my wrist on the head, a bit of into the temporal area, a bit of pressure, and then my fingers on the neck, and then pretty much do the same thing.
Do the fingers touch, Joe?
Yeah. So my fingers are on the suboccipital area. I need to be careful not to ruin their ears. Yeah. So, yeah. Or any of these. Now, if you get into a traction, do you understand what traction is? You're just elongating the spine longer. And it's a question of maybe 1 or 2 centimeters. And then you can keep it the same way and then move it really slow. While in traction. So all the time my body weight goes this way. Yeah, I'm pushing and stretching the neck. Do you feel it? Really nice. And then roll it. Don't roll it actually deeper into the massage table. Very good, yeah? Cool. Okay. Okay. You can do some nice game, nice playing. You see that I'm doing oscillation? Yeah? Be careful, because sometimes it can, if people are very apprehensive, they might not like it. But if they're very relaxed, you can actually relax the whole spine by doing this oscillation. Okay? Okay. Another stretch, side rotation. Now, I don't lift the head. I roll it. So actually put more pressure onto the head and move it, roll it this way. Yeah? And then this hand does not move, and the hand down move. I don't want to create too much pressure there. So hold.
So the one on the shoulder.
The one on the shoulder move and stretch. Very light. Let them breathe. Reduce it a little bit. Do it again. Okay? And then do the other side. So this is a rotation stretch. Now you can do a side bending stretch, which you stretch this way. Yeah? Light. Which muscle is very good here? Our friend scalenes. Scalenes. Yeah? Sternocleidomastoid as well, but mostly the scalenes. Yeah? Nice stretch. Another stretch, I would need a chair for that. Actually, I'll start without a chair. And I would use a bit of my abdomen to stabilize their head. If you don't feel comfortable, you can use a pillow or a towel.
Drew, when you did the side bend,
Yep.
do you push on the shoulder as well at all?
You can. So you come into it. No, don't lift it. Relax. Yeah. A lot of it is education. You're trying to really to educate their muscles to relax. So don't let them help. Yeah. So you're coming down and you're putting your weight a little bit into the body, and then you're holding your hands and then you're lifting your body together. So actually you don't do anything with your, it's mostly coming from the knees. Do you see the knees? Yeah? And you also my abdomen through the pillow support it. And then you can do really nice movement this way. Maybe the camera can come near their feet, near her feet, yeah? Good. So again, yeah, I will come quite down. If I'm standing here, quite down, support, and then nothing happened with my upper body. It's all lower body. I'm stretching, yeah? Now you can start do some nice movement, either this way or rotation, but you need to have lots and lots of support. Your body onto their hand, your fingers onto their neck, and your base of your wrist onto their skull. You see that? Only that would convince them to let go. Yeah? And then your fingers can do a nice massage on their erector spinae muscle. Yeah, good. And slowly bring that in. Okay? Another stretch, even stronger, would be to come into sitting. Put your hands at the beginning this way. When you're lifting it, you're turning. Yeah? Good. And you're supporting their neck this way. So really a lot of support. And then you try, it's all a really little movement, really small movement. And you need to feel whether they're letting go. Just by playing it a little bit down, a little bit up. And then slowly rotate it and bring it back to place. Okay? Yeah? Nice movement. So a lot of support. Yeah. Should we give it a try? Mm-hmm. Good. I'll come and help you around. Yeah. What was most to show you the technique, the neck technique with the elbow. Remember? Yeah. So what you're doing is that you slowly roll her hand until it's on your hand, and then you're lifting it, and then you're putting the hand over there. So her neck is on your forearms. One hand over here, that's all what you have, and then you start rolling it this way, and then you assist with your left hand that way, and then you can actually kind of create like a circle. And then you can rotate it. The idea is not only the stretch, but actually educate the nerve system to let go. Okay, so very slow. You can even leave their head here, and then work onto here. Just a simple one, okay? Thank you. Right, so the arm. Now there are few joints we can actually stretch here, yeah? So we're the wrist joint, elbow joint. Now we have also the shoulder joint that does the flexion, extension, abduction, adduction, and rotation. But also we have a scapular movement, yeah? And all the muscles around that. So a lot of the stretches are actually used not so much for the shoulder joint, also for the shoulder joint, but more for the muscles around that. Yeah, because usually the shoulder joint has a lot of movement. The problem is that muscles around, and because of our kyphosis position, it's hard to move. Do you see what happened? If you're in kyphotic position and you try to lift your hands, it's hard. But if you put your back straight, but I didn't do anything for the shoulder joint. I changed the upper back, Does it make sense? So a lot of the work that I'll teach you is not the shoulder joint movement, but actually the upper back scapular position, yeah? Okay, so first of all, you can do like a really nice stretch downward. And what do? You put the head to one side and you hold the hand this way and you just have a really nice and long stretch for the upper trapezius. Yeah? So I'm putting traction this way. And then you can start moving. You know? Oops, that was terrible movement because I was very quick. So I need to let go, prepare myself, engage again, and then really slow move. Sometimes I will use the forearm because especially ladies, the wrist joint is so flexible that I start feeling that it's getting too much stretch in this joint and I don't want it. So I would use that movement or even here. And then slowly you can relax again and then again very slowly to move. And then going all the way up. Okay? Now, some of our clients would not be able to do that only here. So you need to be able to actually acknowledge it and don't stress. That will be really painful for them. Can you think about one person that might not be able to put their hand, the arm all the way up?
Yes, I got one.
An example for yourself, okay? So just look at it and try, don't force it, okay? Now, what can you do? So if they are there, you can hold it in two hands and maybe a little bit down, little bit further down, okay? A little bit further down, okay? Then you can bring it to the side, hold it this way, and maybe push it this way. And then when you do that, you can assist the ribs as well. You can do alternating hands, yeah? So. I'm really digging into the scapula there. Yeah. Coming back to here. Yeah. I think that's it really for now. Okay? So stretch. When you're stretching, what I would like you to feel is that what is the tissue end range of resistance? When do they actually start resisting? So now I move. Okay. Around here, I feel that the more I do you see what happened? Her head move? Because that's it, it's the end of the stretch. So I'll wait there. Wait. So in a stretch, you're really talking to the nervous system to say, okay, let go. But you can't just say, let go. You have to say, let go. Quietly, okay? So try the whole circle all the way up. You can do another thing. You can bring it upward from here. You can do it with two hands. See how much they can go down and where. Is it here? Is it here? Okay. A bit of jostling as well. And then for the last one, you can do two hands. Yeah? And that could be really nice. Relaxed. Stretching.
Are you alternating?
So yeah. So actually, I feel that actually it's coming from my hip, because I'm kind of don't do nothing, just a hip move. Yeah. Okay. Yeah, simple, joyful, and playful.